Hello everyone, this is Dr. Mike and I'm back here now with our Medical Exercise Training 101 ebook, and we're going to look at tip or concept number 10. Now this one I think will be very interesting to all of you, especially if you're doing any aspect of corrective exercise, which I'm finding now in the fitness industry, the majority of fitness professionals do some aspect of corrective exercise. And corrective exercise has come so prevalent in the fitness industry. Sometimes we need to make sure we understand where it fits in and how it relates to other services, particularly medical exercise training. So here's number 10. Is there a difference between medical exercise training and corrective exercise? Medical exercise training is specifically designed to use exercise as the sole modality in managing medical conditions. Now, sole modality of the medical exercise professional. Other or licensed medical professionals may do any of the modalities, but for the medical exercise professional, your sole modality is exercise. It also requires collaboration and communication with medical professionals. Corrective exercise is the management of postural and muscular imbalances. Some say corrective exercise is part of MET. If the corrective exercise client has a medical history that is remarkable for an injury, surgery, or a medical condition related to the postural muscular imbalance, this client should be then classified as a medical exercise training client because they have a medical condition that's underlying their postural and muscular imbalance. If the corrective exercise client has an unremarkable history, so they don't have anything in their history that is related to a medical condition, an injury or surgery, anything along those lines, then simply manage the client, his or her posture or muscular imbalance with exercise. This scenario doesn't require communication with the doctor, therapist, or chiropractor. So the person just walks in and they've got a postural muscular imbalance and there's no history of injury, a medical condition, an accident, a surgery, anything like that. Go ahead and start working on stretching them. But here's the rule of thumb. And when I say stretching, strengthening, stabilizing, whatever the case is. But after 2 or 3 sessions, if you don't start to see some level of improvement, there may be something underlying that postural muscular imbalance that's more nefarious. It could be a nerve root disorder. It could be a joint disorder. It could be an organic disorder, as in, let's say you have a client that has left shoulder pain, consistent left shoulder pain with exercise activities. Folks, especially in that middle-aged male, that could indicate the early stages of a heart attack or myocardial infarct. So we have to make sure that with these clients, we get a medical history and we're always cognizant of the fact that everything isn't related to postural muscular imbalance. When I say everything, every ache or pain or imbalance isn't just simply muscular. It could have other origins, and we need to be cognizant of that. So yes, there are subtle differences between medical exercise training and corrective exercise. Every medical exercise professional should be well versed in muscle strength testing and assessing posture and or muscular imbalance. I highly recommend courses offered by Dr. Shirley Sharman. Dr. Sharman, if I'm not mistaken, I think she now has left, but at one point she was the chairman of the physical therapy department at Washington University in St. Louis. I took a few of Dr. Sharman's courses early in my physical therapy career, and they were fantastic. I got to know her a little bit over the years, going down and taking her courses. And folks, she truly is the authority, or at least at that time was the authority on muscular and postural imbalances and how to manage those and how to identify them. I know a lot of you take corrective exercise courses. She is the authority. Take her courses. I'm not sure if Dr. Sharman is still teaching those courses or not. If you can, take her course in person. If you have to travel to Timbuktu to take the course, take it. I was able to do that early on in my career, and it was invaluable. She also has a couple of books out. I'll talk about those in just a second. But if you're going to talk about postural muscular imbalances, go to the person who's done it the longest, who's considered the authority, and that person is Dr. Shirley Sharman. She's probably the top authority here in the United States on managing postural muscular imbalances and identifying them. I highly recommend her book, Diagnosis and Treatment of Movement Impairment Syndromes. And let me say one thing about a book. Dr. Sharman's book was designed to go along with the course she taught at Washington University in the physical therapy department. I think there's a fallacy here that if I just simply get the book and read it, I'm good. And folks, that's probably the farthest thing from the truth there is. Just getting a book and reading it, especially a textbook is designed to accompany the lectures and the explanation of a instructor that has a significant amount of experience in the area. So I know a lot of you like to grab books and read them. And I've had students tell me, hey, I purchased this book and I got it and read it. But when we really drill down and start asking questions about what they understood, sometimes they're like, well, I kind of didn't understand all of it. And when we take information, especially in a medical situation, and we start applying it and we don't really understand it, that can be a bad thing. So I urge you, if you're going to get Dr. Sharman's book, purchase her course. She has a number of videos that are out on YouTube. Look at those videos along with reviewing the course information. It makes a world of difference so you're 100% clear on what the understanding is. And if I may, let me continue. I also recommend reading the Compendium of Vladimir Yonda. I had a great opportunity of reading Dr. Yonda when I was at Michigan State. There are links to these texts that are going to be found in question number 89 as we go through this. So you can page through the book and find question 89 and find those links to his compendium. But please make sure that you don't just simply take what the fitness professional is telling you about posture and muscular imbalance, but you actually read where they're getting the information from, and in many instances it's coming from Dr. Yonda as well as Dr. Sharman. Every medical exercise professional should be acquainted with corrective exercise techniques and the importance of conducting a comprehensive medical interview with the client before beginning any assessment or exercise activities. So yes, there are some differences between medical exercise training and corrective exercise. The two are not identical. And remember, when we're looking at that postural muscular imbalance, if we do see a postural muscular imbalance and there is an underlying medical condition that goes along with it, this client is now classified as a medical exercise training client. The one concern I do have with corrective exercise is the corrective exercise specialist is kind of the lone ranger. You see this client in the club setting or in your fitness setting or in their home, wherever, and there never is any communication between the doctor, therapist, and or chiropractor if they have a physician of record. And with that being the case, my question becomes, how far are you able to proceed if after that second or third visit you aren't seeing any changes without having an x-ray, a CAT scan, or MRI, and really finding out what's going on there or conducting a thorough medical history? I think corrective exercise could set us up, or some people up, for some problems. It is a very needed component and a very needed service, but we also need to make sure that when we provide the service, if there's an underlying medical condition, we need to make sure that has been thoroughly taken care of before we just make the assumption, oh, this is muscular in nature. It could certainly be something else. And I have a couple of stories I'll tell you when you join our MedX Pro network, where as a young therapist, I thought something was postural muscular in nature, and it ended up being something far more involved that eventually led to at least 2 patients' deaths. Not that we caused the death, but the condition that both the physician and I missed was the cause of death for the client many months later. So thanks for watching. We wish you the best, and please come back for our next tip. Thanks again.